Good morning, everyone. In the language of the Kaka people of East Coast Centre, Seven Worldwide, thank you very much for the opportunity to speak to you all this morning. It's my privilege to be given the chance to talk about a topic that's very close to my heart, which is primary health care, and supporting the development of primary health care in my adopted home of Vanuatu. As Dr. Appy said, I've spent several years in the Pacific and have the opportunity to contribute to developing the primary healthcare system, and particularly the workforce in Vanuatu at the moment, thanks to the opportunity afforded to me by Health Specialists Limited and the Vanuatu Ministry of Health, engaging me as the academic program leader here in Vanuatu. So we're going to be talking today about healthy islands. I'm sure many of you in this room will be familiar with the Healthy Islands vision for health systems development in the Pacific. We're going to put this in the context of Vanuatu and the primary healthcare journey that we're on in Vanuatu. And I'm going to describe what I think is an opportunity to pursue this primary healthcare journey in the near term in Vanuatu with a proposal project called Achieve PHC. This clicker doesn't seem to be working, so Marta, I'll just let you know when I need to move slides. Next slide, please. And just as a little example of one of the outcome measures you could talk about with primary healthcare system strengthening in Vanuatu, this beautiful little bubba in the picture is my custom niece up in Santo, her name's Miracle. She was born at 28 weeks gestation. And thanks to the incredible work by the nurse/midwife in Vena Village, and then the follow-up care provided by my colleagues at Northern Districts Hospital in Santo, this little girl is now a bubbly, bouncing one-year-old. It's just she really is a miracle. Next slide, thanks, Marta. So that's one baby. These are my other babies. These are the trainee interns that you've all seen around this morning, the bright, beautiful, intelligent people that have been distributing the lays and clustering up the back and in the back rows. Just raise your hand, TIs. Yeah, give a little wave. There's a few of you around. So it is a great pleasure and a profound privilege for me to be involved in this program of designing and delivering an intern training program for the rapidly and substantially scaled up junior doctor training program here in Vanuatu. So I'm very proud to be part of this, and we're all very proud of these young people having spent 7 years in various parts of the world, many of them in Cuba, studying medicine in another language and having just returned to their homeland to embark on a career in medicine. All signs are that these bright and, may I say, very good-looking young people certainly have the future of the health system of Vanuatu in their hands, and it's in very good hands. Next slide, thanks Marta. If we just go on a little historical journey for a while, this is almost 30 years ago here in Port Vila. Now some of you in this room may recognise some of the people in this picture. This is a workshop in 1986 that WHO and the Vanuatu Ministry of Health hosted to map out the direction of primary health care in the Pacific. I think it's interesting to contrast the photo of our trainee interns from last week with this picture from almost 30 years ago. I think this represents a significant journey already, and we've still got some way to go. Next slide, thanks Martin. Just to give a quick sense of the timelines involved, since, as the Reverend mentioned in his opening prayer this morning, WHO defined health as not merely the absence of disease, but the promotion of well-being and all the determinants of health. That led some decades later to a very famous landmark document called the Declaration of Alma-Ata in what is now Kazakhstan in 1978, when primary health care was defined and prioritised by all the member states of the World Health Organization. Vanuatu was one of the first countries in the region to prioritise primary health care and set up a dedicated program of primary healthcare systems development. And Pacific Islands as a whole have been committed to primary healthcare as the cornerstone of health systems development, at least since the mid-1990s. Again, the Pacific Island health colleagues in the room will be very familiar with the UNUDA Declaration and the formulation of the Healthy Islands vision for the Pacific, which was 20 years ago this year in Vanuatu Island in Fiji at the Pacific Health Ministers meeting. Right through the 2000s, there was ongoing commitments by the Pacific Health Ministers to primary health care and support and development thereof. Vanuatu was a big part of that, and the international commitment to primary health care support was led by WHO, which in 2008 published a report called Primary Healthcare Now More Than Ever, acknowledging that even in the 21st century, the fundamental foundation of health systems development was primary healthcare. This year, at the 20th anniversary of the original Healthy Islands Declaration, which was once again held in Vanuatu and Fiji, there was a reaffirmation on the part of the Pacific Health Ministers to prioritising primary health care. And the evolution of the concept is now changing from having healthy islands to islands of wellness, which is a reflection of the symmetry of this concept of health and wellness. Next slide, thanks Martin. We've got a few to get through here. So we're going to define primary health care as it was described in the Declaration of Alma Ata, number 1, thanks Marta, which is the, we'll have next, hit the thing. Oh, there we go. Sorry, it's not coming up on my screen because it's a completely separate computer and we're not connected. Thanks, Martin. So you can see that the definition of primary health care is that it's the fundamentals of health care based in scientific evidence and practiced in a holistic manner. It means more than just treating of disease, it's prevention plus treatment. The concept of primary health care is that all people are able to access services equitably and that these services are universally accessible. The community's engagement is key elements of primary health care. That social determinants of health are not something that is an optional extra or bonus to be addressed, that this is really at the heart of primary health care. And that strong primary health care enables social and economic development. Next slide, thanks Martin. Just to give you an example, we're back in East Coast Santo now. These are some of the sorts of things that, that my community up in Bene have been doing over the last 10 years or so, looking at the determinants of health, water, and sanitation and hygiene, food security, energy independence and education. We consider these in our community to be all part of wellness and the development of our community, although they all have very close links with the prevention of disease and promotion of healthy behaviours. Next slide, thanks Michael. So the original Healthy Islands vision is lovely. I think it really captures the Pacific spirit, the mana and the vision of what health and wellness means in the region. The vision articulated in 1995 is that healthy islands are places where children are nurtured in body and mind, environments invite learning and leisure, people work and age with dignity, ecological balance is a source of pride, and the ocean that sustains us is protected. So it's very much a big picture, holistic view of health. And Marta, if we could hit the next slide, you can see that the thinking in Vanuatu is that healthy islands is the vision and primary healthcare is the tool to achieve this. At this point I'd like to acknowledge my friend and colleague, Ms Miriam Arbel, who's the Ministry of Health and WHO focal point for primary healthcare. Just a little wave, Miriam. I'm sure most people know you. So I have blatantly stolen much of this material from Miriam, or she's been generous enough to allow me to use it. I'm learning from Miriam about Vanuatu's approach to primary healthcare development, and it's from Miriam that I've learned this phrase, Healthy Islands, the vision, primary healthcare tool. I think that's a really effective slogan for us as we move forward. Thanks, Marta. So just to sort of visually look at how primary healthcare principles in Vanuatu can be linked to the evolution of the health system. First of all, we must acknowledge that a lot's already been done. So in that bottom left corner, we're building on the initial efforts towards strengthening primary healthcare systems. We're engaging and supporting and enabling the evolution of this concept of comprehensive holistic primary healthcare. And it's both a top-down, national, regional, policy level effort combined with a community level grassroots engaged and empowered mechanism. It needs to be very much linked to health system strengthening. Primary healthcare has been one of the fundamental priorities of the Ministry of Health Strategic Plan for decades, and the social determinants of health is a intrinsic part of this whole process. Thanks, Martin. For those of us engaged in healthcare, or even just as citizens of our communities, we need to think about how do these principles apply to me as an individual or my family or community. So when we're well, we need to have settings that enable us to stay well. When we have risk behaviours or intrinsic risk factors that may lead to us becoming unwell, that's where we need the health promotion and behaviour change. And when we're unwell, that's when we need strong, sustainable primary health care. Thanks, Marta. In Vanuatu, there's been a lovely articulation of the 4 priority settings to enable the Healthy Islands vision of Islands of Wellness to be implemented. There's the healthy market, the healthy school, the healthy village, and the healthy clinic. So we're once again back at this concept of there being more to health than just treatment of disease, and more to health care than just health facilities and doctors and nurses. So, next slide, thanks Marta. So where can we go to achieve this vision in Vanuatu, perhaps as a model for primary healthcare systems development in the Pacific? Well, there's a few key elements that I think are within sight and potentially within our grasp. Health professional training and capacity building is key. That's why I'm so thrilled and honoured to be part of this formative and auspicious stage in development of the health workforce in Vanuatu. Some of our trainee interns, I hope, will go on to become primary care specialists, whether that's in the emergency department, in the outpatient clinic, in the rural hospitals, and doing community health outreach. Doctors are only part of the health professional workforce, of course. Our nurses, our allied health workers, our village health workers are all core, critical components of the primary healthcare system, and all of them need to be given opportunities to increase their skills and develop their professional pathways. Of course, there's a policy and advocacy element, and it's wonderful that Vanuatu has prioritised primary healthcare for so long and is undergoing a process of revision of some of these policies and plans. There's the opportunity to support these processes, the workforce systems development, the policy development, the community engagement, with some research infrastructure. And as academic program leader here in Vanuatu, and with an academic appointment to the University in Australia, I feel obliged to support this process with some strong academic foundations. And there's great opportunities to engage some colleagues here in that process to enable us all to develop our research and academic skills. And there's the support for the primary healthcare systems themselves. Not just the health workers, not just the infrastructure, the clinics, not just the drug supply chains, but the healthy markets, the healthy schools, the healthy villages that support the healthy clinics. And when we talk about primary healthcare services, services are great when they're there. When they're not there, we need to provide them. So the concept of service where there's none and support where there's some is key to supporting and strengthening primary healthcare systems. So how can we achieve this? Next slide. Thanks, Marta. The proposal that we've come up with as a potential collaboration between the Ministry of Health here in Vanuatu, my university, James Cook University, and some of the NGOs and other implementing partners active in the primary healthcare space in Vanuatu, is to evaluate our systems first, identify the gaps and address them. And we do that by attaining, we'll just keep clicking, thanks Marta, attaining comprehensive healthy islands evaluations in Vanuatu to enhance primary health care. Put that all together, you get Achieve PHC. And my little niece Vincent thinks this is a #1 idea. Next slide, thanks Marta. We're not starting from scratch. There's a lot of work that's been done on primary healthcare systems development in Vanuatu, much of it led by Miriam and her colleagues at the Ministry of Health and WHO. So we're seeking to build on this, add what extra support we can do, and together strengthen primary healthcare systems in Vanuatu to achieve healthy islands in the Pacific. Thank you very much.